So for the procedure itself, the whole thing lasts about 45 minutes. It's each eye, they cover your whole face and they just leave an opening for one eye at a time. And they gently clamp the eye open, kind of hold it open, and they have you look at some lights. Honestly, they look more like marshmallows than lights, and you can't really see anything. It's very out of focus. There's a lot of different lights. You see like pinks and blues, a lot of different colors, and they just kind of tell you, look this way, look that way, look towards me, and you don't really see anything. You just kind of try to look that way. And you do feel pressure. They keep putting drops, some sort of numbing drops or some sort of hydrating drops. I'm not sure what all of the drops are, but they keep doing that, and they insert the lens. They make an incision, they insert the lens, but you don't feel any of it. You just feel pressure for the whole thing. And then they move on to the other eye, and they do the same thing there. And it's just hard to look at the lights. Honestly, that's the most uncomfortable part, because you want to close your eyes, but you can't. And you want to look away, but you can't. So that's the worst part about it, but it's really not that bad. Especially considering it's so short, it's really not that bad. Immediately afterwards, they say you can open your eyes and see, but it's hard to open your eyes because you kind of just want to keep them closed. They're like a little bit, they're stinging a bit. They're not very comfortable. So I did peek and I could see things, and it was like different, because normally I would open my eyes and can't see anything, and I could see everything. But I just opened them a little and I closed them back up because they were kind of stinging. So then afterwards, I was wheeled out and put back into the recovery room where I was with my husband. And it was very uncomfortable in the eyes, very like discomfort type of sensation. It feels like dirty contacts almost, or like there's just a pokey feeling in your eyes. But not nearly as bad as like, you have something stuck in your eye. It's not like that bad. It's just an overall discomfort. And I did have to go to the bathroom, but because of the Valium, things like that, you're getting up, you kind of feel wobbly. So you need a little help, possibly. I'm sure everybody's different with that too. But when I looked in the mirror, the eyes were a little bit red. So that could be, they've been poking around and all that in there. But over time, like even within the 2 hours I was there, I felt like the discomfort was definitely subsiding. I felt like everything was going back to normal. And I could see, like I said, I could see everything. Then after 2 hours, the doctor checked for, lens placement. They kind of shine that light in your eye where you have to put your chin in the machine, and they check both eyes. They kind of make sure the lens is in place. And then you have to go and get like immediate post-op, like a pressure check. So to go there, I had to get like a little test. They had to kind of poke my eye with a fluorescein stain, something like that, and they checked it, and everything was like normal pressure. But I did notice that there was clouding in my left eye, which wasn't there before. And then over the day, like over the next couple of hours, I noticed some clouding in my right eye. So the best way to describe the clouding is it's not that I can't see. The vision is great. I can read, but it feels like there's a veil, like you put like a curtain in front of you. So you're looking through like a curtain. Kind of speckly, but more like just kind of clouded vision. So I was a little concerned about that. And I called the doctor. They said that that's kind of normal or to be expected because of the inflammation. And I am given anti-inflammatory drops to put in my eyes 3 times a day. So it was kind of probably due. So I had put in the drop, and then I kind of just rested my eyes and closed my eyes for the rest of the day.